Welcome everybody to CC Animal Health's wonderful activities for people who are at home working with animals. And for those of you in shelter and rescue, we particularly welcome you to today's discussion called From Stay at Home to Forever Home, Help Rescue Stay Rescued Post-Pandemic. Our speaker today is Dr. Ernie Ward. He is a graduate in 1992 from the University of Georgia Veterinary Clinic and School. And he is a multi-award-winning author and television guest as well. In fact, way back when, I saw him on Rachel Ray, who I follow religiously. Dr. Ward is the founder of Seaside Animal Care, a national practice of excellence, award-winning small animal veterinary clinic, and The Doggone Healthy, a practice dedicated to nutritional, behavioral, and integrative care in Calabash, North Carolina. He is a multiple speaker and recently was awarded the Speaker of the Year award for both the North American Veterinary Conference, NAVC, and Western Veterinary Conference in Las Vegas. He has spoken at every major North American veterinary conference as well as throughout Europe, South America, and Asia, and he has been a guest lecturer at most United States veterinary schools. He has received numerous awards and designations from various medical organizations, and we welcome Dr. Ward.
Oh, thank you so much, Carolyn. And thank you to CC Animal Health for sponsoring this special webinar. Today, we are focused primarily on foster, rescue, animal shelter personnel, and some of the unique challenges that you are facing because many of us have seen a surge in pandemic pooches, people adopting and fostering pets during this quarantine time. And our biggest worry, at least from many of my colleagues and trainers that I work with, is that we're going to see people relinquish and encounter behavioral challenges primarily on the other side of quarantine. And so today I want to speak a little bit about some of the advice that we are offering both in the veterinary profession, but also amongst trainers. And I think that this can help you when you have those questions from panicked pet parents. And many of these are going to be new pet parents, inexperienced pet parents, younger pet parents, and you're going to have, questions that are challenging. And I think that we want to give you some tools and resources to rely on to give them more confidence that they can help their pets adjust and ease. So we will definitely be, having plenty of time to take your questions. Obviously, I can't speak to specific dosages or drugs or brand recommendations, but I will be able to speak in general terms about the advice that I think you should be giving. Again, I want to first of all thank you for attending this, but more importantly for your commitment and dedication to helping animals find a forever home. So if we could, we'll go ahead and start with the slides. Here's just some contact information with me. Please do me a huge favor. Follow me on Instagram. Follow me on YouTube, especially at Off-Label Veterinary News, because I do try to bring content like this to veterinary professionals and pet professionals every week. We also have a very popular podcast called The Veterinary Viewfinder that I co-host with a registered veterinary technician, Becky Mosser, and we're now in 3.5 years of doing this podcast. We're the top podcast. We're in the top 20 even for all of iTunes Pets and Animals podcasts, but we do tackle, as we say, the toughest topics in veterinary medicine. And so I think, subscribing to that would be really beneficial for you all. And of course, you can reach out to me on LinkedIn, on Facebook, and so forth. If we could take the next slide. All right, so here's our goal over the next 30 minutes, and it's ambitious, and we're going to have to speak rapidly, but I want to cover some really important grounds. Number one, we want to tell how can we identify separation anxiety in a foster or rescue dog. We're going to give some of those tips that I mentioned earlier for these pet parents that have been staying at home, and what can they do to sort of ease this transition. I am going to speak about some of the treatments that we do commonly employ. Many of these you will be very familiar with, but I'm also going to talk about some exciting new research in animal behavior and a new product that I think you need to know about. And of course, we're going to have time to take your questions. If you have a question throughout the first part of the presentation where I'm sort of reviewing some slides and basic information, just go ahead and put them in the comments. We'll be collecting those and then get to them at the end of the presentation. So slide. All right, so There's a little bit of a chicken or the egg paradox when it comes to dealing with, especially, rescue and foster. And I have very deep history. In fact, I came from working for the Albany Humane Society, which was run by the HSUS at that time. That's what I did as a young college person and high schooler. I graduated, unfortunately, to being the euthanasia person. So I can definitely speak to the horrors of that end of the business, if you will. Euthanizing 20 to 30 dogs 5 days a week really changed my perspective on shelter medicine and how animal shelters should be run, and just my overall viewpoints on animal rescue, fostering, and so forth. And I think that's a unique perspective. A lot of, very few veterinarians have that level of experience. It was emotionally challenging, as many of you can relate. Yet on the other side of it, I was able to gain significant insight and, change in approach. And that's why anytime when someone says, would you like to speak to, a rescue organization or a foster organization, that's why I sit on the boards of several, because this is near and dear to my heart. It shaped me at a time that was pivotal in my, burgeoning career as a veterinarian, but actually working at a humane society in an animal shelter in rural Southwest Georgia during the 80s. I think many of you can probably already conjure up the image of what I was confronted with as a young person. And so I really treasure those experiences, but that's why I'm here today. We do know that dogs that originate in shelters, that have a rescue background, that come from those that we are always ways, dogs that don't have any obedience training have a higher predisposition for developing canine separation anxiety. And that's really important for us as a community of foster, rescue, and animal shelter personnel to own this, to accept that the pets that we may be adopting out or placing in a foster home are more likely to have behavioral disorders. And, I think sometimes we want to deny this, but this is just the facts. That you guys, that anybody that's done this for any period of time, we know these boomerang dogs and even cats and other companion animal species. And so we have to own it, because this allows us to shape the messages going forward and what how the advice that we will give to a prospective pet parent. So next slide. So I want to talk about some of the factors that also amplify the risk for separation anxiety. Transitioning to a new home, regardless of its origin story, is challenging for any companion animal. Heck, it's hard for people. So when we take them out of one environment and we place them in another, suddenly, abruptly, this can trigger a variety of behavioral problems. Most of these dogs don't have a set routine. If they've been in a shelter for a while, hopefully they have had an established structure, but then suddenly that gets flipped upside down when they go into a new home. And you're going to continually hear me today talk about the importance of daily structure and why that is so impactful in preventing some of these conditions. New people, new dogs, again, we take them out of a foster situation or into a foster situation, and suddenly everything's different, and there's different sights and smells, and there's an animal that maybe is displaying territoriality or food aggression or whatever. Just being in a new environment can trigger it. Change in diet. This is something, as many of you know, I co-founded a plant-based dog food company out of Berkeley, California, called Wild Earth. And we work a lot with local shelters there in the Berkeley, Oakland, California area. One of them is Rocket Dog Rescue. So shout out to our peeps at Rocket Dog. But this is one of those things too, where we see they've been fed a high quality or as high a quality diet as we can in the shelter. And then suddenly we place them in a home and, they're feeding Lord knows what, and we start to see then changes in behavior. There's an interesting researcher, fascinating friend of mine, Dr. Holly Gantz, with a company called Animal Biome, again, out of Oakland, California, where we're headquartered. And she's doing all this research, and we're starting now to make conclusions about changes in the microbiome and how it influences a dog's behavior. So again, fascinating world of research that I'm personally intersecting with, but it's something just to be aware of, that changes in diet can actually cause a change in behavior. Again, the pet parent experience. And I wanted to overemphasize that aspect today, because if you follow Instagram, if you follow Facebook, if you follow Snapchat, what you've seen are probably millions of young people who've adopted or fostered pets, primarily dogs, during this quarantine period. And that means they likely have little experience. For many of them, this is their first real adult pet, right? They maybe shared their home with a pet growing up with their family, their parents, but now they're out in an apartment or on their own, and suddenly now, they've got a lot of questions. To veterinarians for the past 10 years, I've said, look, this is a once in a generation opportunity, because we literally are seeing millennials and now some of the older Gen Zs come online, become adults, and they're bringing in pets. Of course, we've seen statistics to support that in the US and Western Europe, people are delaying the time or the age that they have children or start their own families. We're seeing delays in marriages and other responsibilities. So again, our pets are filling that void. But getting along with this concept, I do worry this lack of experience is going to lead some of these newly minted pet parents that have adopted or fostered during this time to maybe have questions or perhaps even make some mistakes. Okay, next slide. All right, so for the past 8 weeks, most of the United States has been on stay-at-home orders. The work has been limited to essential professions such as veterinary medicine, human health care, grocery stores. I mean, the story here, but a lot of people have had to transition swiftly to working from home. And I really think that this is a challenge, even if it's an established dog, but certainly more so during an adopted or foster dog during this period. But let's take a look at what's happened, right? So 8 weeks ago, roughly, you were going to work, you left your dog, cat alone all day, you went to school, you did whatever, they came in, they had probably were acclimated to that, whatever degree, however they coped. I mean, but that was the standard routine. Then suddenly mom and dad are home all day. And they're home all day for weeks and weeks. And if you look at some of the psychology studies, it takes about 66 days on average for a human to do something daily, a daily routine, to turn into a long-term habit. And for my 28 years of practicing veterinary medicine, I would say a couple of months of daily structure in a dog's life can also lead to these sort of quote unquote habit forming. Okay, so these behaviors, after 8 weeks of being at home, snuggled in mom's lap all day long, getting constant attention, many of these dogs have now adapted to this new normal. And that's really where the concern begins, because it's going to be this abrupt shift back, from 8 weeks of stay at home to now you're gone 8 hours every day. This doesn't sit well with many dogs. Dogs rely on structure. They need structure. And suddenly to have it upended, they just aren't good at transitioning. So we're going to talk about that. The other part of this is the psychology just of dogs. Remember that the dogs that we share our homes with today, regardless of breed, have been selected by hundreds of years, I would argue thousands of years, of evolution to get the desired traits. This is what we call trainability in the world of animal behavior. But these are dogs that over the millennia, we have selected as our companions because they would do something for us. They would guard, they would help us hunt, they would find things, find food, truffles, for example, right? So there's all these tasks that we have sort of selected for. We've identified the traits that we desired, and then the dogs that were able to do that, we bred them and we propagated those traits. So the genetics of this also lead it to say, hey, these dogs are constantly learning. And this is why I always say, during the past 8 weeks, your dog has been at secret doggy school, right? They've been watching your every move, adapting, and now they've learned new lessons potentially. And those lessons could turn into habits and actions. And the one thing I've stressed in most of my career, and this goes back, long before I was a licensed veterinarian, but just working with trainers as a young person and in vet school and so forth, I learned the value of constant reinforcement. And so this led me to, I'd use this with not only my staff, my young doctors and my RVTs, but, constantly just taking time out to do these 2-minute trainings. And so the concept here for our dogs is that, this is getting back to the learn to earn, right? So you don't give them a meal without having them do something, but 2-minute training just means that you really want to focus on telling those new pet parents, hey, every day, 2 or 3 times a day, especially even before meals, have your dog do a sit, down, stay, come, roll over, paw, touch, whatever those commands are that you want. And I encourage you to encourage a variety of them, but I really want you to make sure that you teach people the value of consistent and constant reinforcement. Okay, so next slide. So if you just look here, a lot of people are asking, and this is Denver. This is a dog that's really displaying what we would call displacement behaviors. But why do dogs get stressed out? Why does separation anxiety, occur? And look, there are a lot of proposed theories, and quite frankly, in all of them are good. We don't really have clear evidence to say one particular theory is favored over others just yet. But what we can do is rely on our understanding of human psychology, and that leads us to this term displacement behaviors. And basically, when you are stressed, when you are trying to cope with some overwhelming emotional state, okay, something that you don't necessarily believe is positive in your life, then you will typically do something else to help you adjust to it. And in human terms, displacement behaviors, a classic is, people that are nervous, twirling, fiddling with their hair. In fact, there are amazing case studies of young women, primarily females because of the longer hair, who develop trichobezoars. You might be familiar with that term because that's the fancy name for hairballs, okay? But actually they can constantly, continually chew their hair, ingest it. Of course, it's not able to be metabolized or digested, and they form trichobezoars in the stomach. And so there's some amazing case studies that just show that those kind of behaviors. But people chew their fingernails, they pace, the things. These are exemplified in canine companions by pacing, watchful waiting, hypervocalization. You guys probably are familiar with these spinning dogs and so forth. So I just want to make sure that we understand that the reason that this happens is because there's some emotional status, some feeling, of panic or loss of control. We can really kind of go any way we want with those feelings, but the dog then, in an attempt to cope with these overwhelming feelings, displacement behaviors occur. So next slide. All right, so if we look at the numbers and we look at this sort of the literature, you see results of around 14. I've seen some surveys that show as high as 20% of all U.S. dogs will exhibit at least one symptom of canine separation anxiety, which we'll speak about in just a second. The real issue here that I want to talk about, there's two things. Number one, the key identifier of canine separation anxiety is that these behaviors develop or occur in the absence or lack of physical proximity to the person, right? So this is not a behavior that is occurring in front of the person typically. There are some extensions that we could perhaps, move that definition. But as far as from a professional standpoint, you guys are working as volunteers or employees in animal shelters. These are those behaviors that occur in the absence or lack of close proximity to a person. And by close proximity, remember, this can be the next room. You can leave the kitchen and your dog suddenly has a panic, and now we're having separation anxiety. So we've seen this doing. The bad news is, or the good news, is that there's no long-lasting treatments other than behavior modification. And that's really important for us as pet professionals, as veterinary professionals, to communicate to pet parents. There is no silver bullet. There is no single device. There is no single solution. This is a multimodal approach. So this is why you see veterinarians like me, often we're combining an anxiolytic drug with a dog trainer, with intensive behavior modification, counter conditioning techniques performed in the home by the pet parent, right? Without all of those three things, quite frankly, the structure falls apart. And you really can't just rely on the trainer. You really can't just rely on the pharmacological agents. You really can't rely just on desensitization, counter conditioning techniques by the pet parent. And I think this is where the friction and frustration begins, because people do want that simple fix. And it's interesting because when you look at the literature on people suffering from depression and anxiety, it's very, very clear that without quote unquote talk therapy in conjunction with pharmacological agents, so they're on Prozac and they're seeing a therapist. Without those two in concert, the successful outcomes plummet. So, we know that in humans, it requires multiple approaches, and the same holds true for dogs. So I think it's really important that we not oversell a single entity. I mean, like I was talking with someone not too long ago. It was a pet parent. Perhaps they had just confused the message, but they had been told by, a trainer that basically if they just did the training techniques with them, that their dog's separation anxiety would be resolved. And while I hope that's true, I just think the chances of that are slim. Okay. We do know that currently about 10 to 20% of the cases that we see in the US are in conjunction with a prescription med. I think that's probably a low number. I think that hopefully more dogs are getting some pharmacological support when necessary. We don't know what that means in terms of supplementation. There are a lot of non-prescription treatments and quote unquote, pharmacological types of treatments that I will use. So, I think there's that number I'm not always so solid on. Again, I think the reason that we're having this talk today is because these are huge, often devastating effects on the family. You and I see it because these are people that then relinquish or re-relinquish the pet to us. I see it for a euthanasia request because they just have reached their end. And the one thing too that you need to be emphasizing to prospective pet parents or pet parents who are calling you with these little questions, this is what I tell my clients. It takes only a few weeks to go from an annoying behavior to unacceptable. And by the time it reaches the threshold of unacceptable, that's when you see the pet back in the shelter. That's when we see the foster fail. That's when I see the client scheduling an appointment for euthanasia, right? So annoying to unacceptable, that escalation is rapid, and we have to emphasize that. So I always tell my clients, in fact, the question that I train my doctors, my staff, myself to leave every time a client sees me, this is what I say. The last thing I say is, hey, before I let you go today, I mean, is Buster doing anything that just bugs you a little bit? I mean, nothing serious, but just like, I don't know, like barks, at the neighbors when they come over to say hello, or just anything like that, jumps up on you, too much. And what I'm trying to get at is, what are those little annoying, nagging behaviors? Because they don't just stay static, right? That little barking at the neighbor when it comes up, that jumping up on me when I greet them, it doesn't just stay there. It continues to progress. And I don't know where unacceptable line is for that individual. So it's really important for us to have these forthright, open dialogues with our clients, our pet parents in your case. And we really want to make sure that they understand that, hey, if it's over here in just the annoying category, that's the time to intervene. That's the time to take action. And that's what we're going to talk about here as we move forward. Okay, next slide. All right. Thank you to CC Animal Health. This is a fantastic chart right here. I couldn't do it better. I mean, this is brilliant art. I'm sure that if you talk to them, you can use this in your facilities as well. Share it with your adoption patients. This is fantastic. But again, these are the classic signs of canine separation anxiety: vocalizing, watchful waiting. Remember, these dogs that are hyper vigilant, and this is, there's some breeds that are more predisposed to being hyper vigilant. Why? Because we bred them for those traits. Destruction, the classic case of the dog, that destroys the couch or chews the kitchen table legs when you're gone. Escapism. I had a horrible case many years ago. Pit bull mix rescue. The dog was obviously suffering from separation anxiety. The people really weren't managing it very well. And so it had destroyed, several bits of furniture in their living room area. So they decided to start locking it away in the laundry room. Well, I saw it on emergency after ingesting about a pound of sheetrock. Because this dog, you guys already know where this story ended up. He was trying to chew his way out of the laundry room. And in the course of chewing the sheetrock, he ingested a lot. So he did fine, but it took us quite some time to really not only deal with the foreign body surgery, but then, of course, to start to take control of the separation anxiety. Potty accidents, shadowing. You know, I call these Velcro dogs. I can spot them as soon as they pop in the clinic, because these are dogs that are just right up against mom's legs, right? Or when they're crating them and they put them on the exam room table, the dog's like, whoa, can't be away from mom, right? Those are those things that I'm looking for. I'm being very attentive for in the exam room. Excessive greeting. You know, typically this is for one person in the family. And a little bit of advice here as we move into some of the treatment things, you really need to make sure that, you know, as I always say, you have to spread the love. I do worry about the households, the young pet parents now, that just one person feeds, one person walks, one person trains, you know. That's really an unhealthy way, or certainly an unhealthy situation to place a dog in, because they become totally dependent upon, and this can make a hyper attachment relationship. So again, excessive greeting, when I hear this over and over again, oh yeah, you know, when mom comes home, she goes nuts, right? And what about dad? Well, he doesn't care much for dad, right? And then you start to say, well, who feeds them? Mom. You know, who takes them for walks? Mom. You get the story. But that's something too, that excessive greeting, I link it with hyperattachment disorders, okay? Pacing, we've seen that, Denver, that video we saw a second ago. Panting, and then self-harm. That's really a great example there, you know, of developing an acral lick granuloma. So you've all seen these, you know, granulomatous sores. They come into the clinic. The first thing I say is, okay, is there a behavior foundation for that? Okay, next slide. All right, so what's not a sign? And I think it is important for us to determine, you know, that there are some behaviors that, while they are unacceptable, they are not typically associated with separation anxiety. Of course, nuisance and territorial vocalizations, you know, these are dogs that, again, say, hey, here is a stranger coming into my home. Therefore, my job is to guard and to alert and to serve as an alarm. So we have to distinguish between that. That doesn't mean that I'm not going to try to curtail or improve these behaviors. It just means it may not be a direct result of separation anxiety. So really, really important. There's a lot of poorly trained dogs out there. And the one myth too that you have to emphasize to your adoptive parents is this, that potty training, house training is not for life. I've never liked the term housebroken. It's a horrible, you know, offensive term to me. It's very violent in its framing. But remember, we tend to think that, oh, we trained my dog when it was young, and therefore it will, you know, never have an accident in the house. There are lots of dogs, due to a wide variety of reasons, including trauma, changes in as we mentioned, diet, changes in scheduling, that then start to have accidents in the house. And so, you know, just changing the duration or frequency of when they're allowed to go outdoors, suddenly now that dog reverts back into elimination in the house. So I would really caution people when they first say, my dog is urinating in the house, you know, or even my cat. Cats typically, I think, more medical conditions. But, you know, again, for dogs, I say, okay, is this separation anxiety, or is this, you know, a case where we need to sort of double back down, if you will, on the house training? And remember, this can occur at any age. I really want you to communicate to pet parents when you get field these phone calls and these questions. Housebreaking is not for life. House training is not for life. There can be other traumas, other instances that cause them to revert back to poor elimination habits. If I see destruction of food items, right? So if the dog is destroying a food bowl, you know, a food station, they're trying to crash into a cabinet where their foods and treats are kept, those typically I'm going to disassociate with canine separation anxiety. Okay, next slide. All right. Dogs less than a year of age, also, I am not quick to diagnose them with separation anxiety. Some of my colleagues certainly will, and I think it really depends on a lot of the particulars here. And so, you know, but typically until that dog has been trained and has some level of psychological maturity, or in this case, behavioral maturity and experience, I tend not to, you know, diagnose them right away, because I think sometimes we can then sort of create a stigma around that dog at an early age, because now a person is much more likely to give up on a 6-month-old, 8-month-old dog who they think now has this condition, this behavioral problem that's going to follow them the rest of their lives. So for me, I'm just trying to say, let's identify the problem behaviors early, 6 months of age, right? That's really when my antenna go up, and yours should as well. And I'm starting now to intervene early, but I personally, in my personal practice opinion, I don't make that diagnosis and proclamation yet, because I think if you brand them with CSA at an early age, people are much more likely, because they kind of go, this is damaged goods. Like, this is a little puppy and he's already got some crazy behavioral problem. I'm just not going to get invested with it, right? I'll try another puppy. That's kind of my fear. And we can all have our own opinions on that, and we can agree to disagree on that approach. There's no right or wrong. That's just been my perspective on that. Again, unhoused broken dog, medical conditions, and age related. When I see dogs typically that are over 9 years of age that suddenly begin doing something, even hypervocalizing, pacing, the big one there for me will be potty accidents in the house, inappropriate elimination, or sleep-wake cycle disruption. So now suddenly the people are like, well, he's just pacing all night long. He's 9 years old. He's never done this before. I'm starting to look for cognitive dysfunction syndrome in that patient for sure. So we really want to rule out other conditions. And again, that's from a veterinary perspective. Obviously, I'm always looking for a disease to blame a behavior on. So, and then when I can't find that, that's when I go into the psychology of it. Okay, next slide. All right, remember too that these dogs with CSA, they've got other problems. Primarily, it's going to be noise phobias, right? So these are the dogs that are thunderstorm phobic, fireworks phobic. They have fear of travel, right? These are crate fearful dogs. I mean, so I always tell people that when one problem behavior develops, as I keep saying, it escalates, it amplifies, it morphs, it adapts, it evolves. And those are really, you have to, we can't just box it off and say, oh, my dog has noise phobia. That's what my dog has. Because if your dog has a noise phobia, I'm telling you, it's more likely a matter of just when they're going to develop another type of behavioral disorder, not if they will, right? Because unless we are taking aggressive measures, really strong desensitization and counter conditioning behavior modification, then we're not going to overcome them. So whenever you are in the shelter, look, and we've all been there, and I've been doing temperament training for well, most of my life, okay, for 40 years nearly, certainly over 30 years, 35 years. But you're doing these dogs, you're doing some basic temperament training or testing, and you're starting to observe things that maybe you're uncomfortable with. Remember that it's not always fair to the dog, and certainly to a prospective pet parent, to just sort of conceal that and deny it. I think that that's also something I've witnessed working closely in animal shelters, is that the fact that we're just not doing temperament testing. We're not trying to pair up and match up with the perfect home whenever possible. Obviously, perfect is a bit of an exaggeration, but you know what I'm saying. So we're not even taking those initial steps. And the second thing is, we're so afraid sometimes to say, this dog does seem to be a little, needs more attention right now. And this dog, we do think it's going to require a little more work, because, we have historically, there's been dogs that just didn't get adopted. I think now, especially with some of these younger pet parents, they're much more willing to take on the older pets. I'm so proud to be on the board of the Gray Muzzle, Society. And so, we found that the number of senior pets, senior dogs that have been adopted over the past 5 years, it's just going up. So again, I just don't want us to be afraid to hold back and not be transparent and truthful, because again, those dogs just boomerang right back. So next slide. All right, so what are we going to do? So I want to kind of spend now here the last bit of this thing on what should we do. And I thought it was really important, because you guys are not pet owners, we're out there now giving advice. I wanted you to be loaded in with some of that stuff, because it's really important to have a foundation here. But the first and most important thing we need to be advising everybody to do is to stick to a routine. This is so important that they have, they get up and they do certain things. Daily structure is really the foundation of good behavior. And I would say good behavior is sort of the foundation of a good human-animal bond. right? Because if there's all this stress and anxiety and friction that's being created between the pet parent and the pet, well, that's just not going to be as rich of a bond as it could be, as it should be. And so structure really means that, you know, dogs thrive on expectations. They just want to know, I mean, they're so closely, you know, governed by nature, by cycles of the sun and the moon, barometric pressure, you know, seasonality. I mean, dogs, you know, are much lower evolved animals, so they're in tune with that much greater than most humans are. And so this is why what they want to know is that, hey, when the sun is up a little while after, you know, and dogs don't have alarm clocks, they're not reading the time, but they do know that the first thing in the morning that we do is we go out for a potty walk. And that's what they come to expect. This is why structure leads to expectations. Expectations means that the dog knows how to live their life, what to do, how to respond. You know, dogs don't do well when things are abruptly shifted on them. So if every day, you know, you get up and you do a quick potty walk, well, that day that you skip that, this can really throw a dog out, right? I mean, they're like, okay, first of all, I really need to go to the bathroom. But second of all, it's like, oh my gosh, what else is going to go wrong this day? And I do believe that dogs have that sort of psychological ability to say, okay, something is not right because my day doesn't normally move this way or proceed in this fashion. So I really want you to stress to pet parents when they're adopting is saying, look, what your dog needs right now, especially during this period of time, it's even more important. But they just need to know that, hey, I can expect in the morning, I get up, we do a quick potty walk, I come back in, you give me breakfast, right? You then take me out for a slightly longer walk in the morning. You know, we're getting ready for work, and that's the time for typically when they will defecate or something like that. But you really, with these young pet parents that are inexperienced, you've got to spell it out to them. You know, we used to have a form, gosh, you know, 25 years ago in my clinics that basically took step by step, you know, what you need to do with your dog. This new pet parent, here are the steps you need to take. And I remember a veterinary colleague, I showed this during a lecture, you know, many years ago, and they're like, you know, that's just the stupidest thing I've ever seen. You're really telling me that you tell people you feel you need to write down that they need to wake up and take their dog out to go to the potty. And I was like, absolutely. Because I've seen too many people that just don't. They feed them first or they do whatever. And then suddenly, you know, they're wondering, why is there a little corner of my bedroom where the dog is urinating, right? It's because he's like, dude, every morning I get up, I got to go. Okay. So I'm going to go when you're not looking, right? So, you know, again, the more specific, the more detailed we can provide information, the better. Set times. Right now, during this work at home, especially as we begin to ease restrictions and people start to resume some normalcy over the next week or two, you need to be doubling down on, and I just made a video of this on YouTube, so if you go to Off-Label Veterinary News, you'll see some of the messaging that I'm encouraging vets to get out, and this is the one thing right now. As we start to transition out, dog owners need to put the dog out of their lap for all their conference calls like they've been doing for 8 weeks and say, I'm now at work hours. And when I'm in my office, you're going to be in the kitchen or den, which is exactly what I'm doing here. I'm still working from home primarily. So my dogs, when I'm in my little home office working, my dogs now, we're starting to transition out because, you know, we're starting to resume normalcy, hopefully over the next couple of days. You know, what I would also recommend, and we're going to get to this in just a second, is that, you know, videotaping is your best friend. When people call me and they say they have a behavior problem, I start by saying, can you take a smartphone video? Do you have a home security camera? Something like that. Cat spaces, you know, safe spaces. Obviously, I'm all about, you know, using vertical spaces and anything I can do for that. But anyway, cat caves, my cat loves it. So I'm looking at one right over here. So next slide, please. You guys know how to really have to take care of cats, right? Positive reinforcement. You're going to get a lot of these kind of questions, especially as we ease out of this. So now you're going to say, okay, that's great. I tried to take my dog out of the room, but they stood outside the door whimpering and whining. And this is where you have to fall back on what I have used as the foundation of all of my dog training for my entire adult life. And that is reward the positive, ignore the negative, unless it's injurious. And again, that's the little parenthetical, because obviously if I see a dog that's about to chew an electric cord, I mean, then I use a disruption, right? I use something to interrupt that behavior. And so, you know, but obviously if they're whining or whatever, if they're not being destructive, causing harm, then the best thing you can do is ignore that behavior. And then of course, as soon as they stop the negative or unwanted behavior, you immediately reward it. Now, this can be praise or food or a combination of the two. But if you've had any experience, and I know many of you have with dog training, you know that the timing is also a critical element to success. Because now if the dog is quiet and we wait, and we wait, and we wait, and we finish that whatever thing we were doing, and then we go out there 5 minutes later and say, good girl, good girl. They're just like, wait, what was the good part? Thanks for the food, but I have no idea what you're talking about. So it has to be that immediate timing. There's so many amazing studies that have been published over just, I mean, we're talking milliseconds, you know, like tenths of a second difference between like better outcomes and not. So it's really, really important. If they're in your lap, if they're in your office, you know, we talk about using the still face, the shunning, the looking away, you know, do the same behaviors that their mom would do when they're teaching them a lesson. So you guys get that, you know, it makes, you guys already know this. If it persists, then, you know, what I will try to do is use some basic counter conditioning. And so what you're trying to do with any type of redirection is the term I guess I use more commonly with clients, because they make sense. So if the dog is doing a behavior I don't want, they're whining outside the door, they're pestering me to get up on my lap during a conference call, and I'm ignoring them and they still are continuing to do it, what I will then do is turn to them and immediately issue a command that I know they know. Right? So this has to be a known command. This is not a training opportunity. But now I turn to them very quickly and I say, sit, or down, or whatever that command is that they know, right? So sit's usually a good one. It's an easy one. So I look at the dog, sit. And if they sit immediately, it's praise. It's a food reward. It's whatever, but always praise, right? Because what we've done now is we've taken the negative behavior that we didn't want, we redirected it into a positive, and we rewarded it with praise or a food. That is such a simple, basic component to dog training. But again, it's that consistency that we talked about earlier. It's just, you know, people don't know to do this. They don't think about it. And what they do is they resort to stop, no, bad, quiet, hush. All these negative reinforcers that don't do anything other than signal to the dog, hey, I got their attention. And this negative reinforcement just leads to more negative attention sinking. It doesn't solve anything. I mean, you know, also, so if they're doing, you know, distraction tools, this is where snuffle match, you know, filling up the toy, like a Kong toy with kibble, or, you know, any type of peanut butter or something like that. I mean, these are the times that I use that. Okay, so next slide. I know we're going kind of deep into this, but you guys, you know, you guys are on the front line of this. If we could go to the next slide. Okay, good. Now is the time. Right now, I want you to tell people there's really 3 things they need to do. I call them the 3 T's. This is what we do anytime for behavior mod, but this is kind of the first step. Right now, what you need to do, you need to test it. Is it happening? Is separation anxiety going to be a problem for your dog? So just have them, you know, take a smartphone, a indoor security camera, whatever they can do, but just walk out of the room, walk out of the house without the dog. And they can't just like stand on the other side of the front door, because I've had this, I've encountered this many, many times over the years. I mean, because then the dog may still be able to smell them or even hear them. And so they need to actually go get in their car. They need to like pull down the street, walk down the block, whatever, and just see what the videotape reveals. Because, you know, usually in about 10 minutes, we're going to see, does the dog continue to wind up, spin up in behavior? The energy level goes up and escalates, or do they start to spin down, wind down, relax, jump on the couch, lay on the floor, do whatever it is that they normally do. But that's the time to test it right now. Do we have a problem? If there is a problem, we start to trial different changes, right? So what can we do with that dog? Can we give them a distraction tool? Can we put a snuffle mat down? You know, can we, again, give them a feeding? Can we take them for a walk immediately before? I don't know what those trials are. There's a variety, big laundry list. We've mentioned many of them throughout this presentation, but I want them to start to try things to counter condition, to redirect, to desensitize. And then finally, you know, what are the treatments? If this is trending towards, wow, this is going to require some work, this does look like canine separation anxiety or relapse thereof, we've got to talk to a veterinarian. I mean, that's just where this starts. And, you know, obviously I am a veterinarian, but I need for people to tell me at the first sign of trouble. So right now I am encouraging veterinarians all over the country to be outward with this message and say, let us know if there's a problem. Okay, next slide. And then we're going to, of course, work with other people. All right, so the other things, you know, you can do, you know, the Mozart effect. There are many species specific compositions. I love daily brushing and grooming, particularly in the evening for my particular pets. That's when, we're done with work and we're back home. But there is this sense of expectation of this big reward. And really, grooming is such an intimate act. It's a strong bonding action between humans and animals. And so I want you to make sure that you stress to these young pet parents in particular, hey, you need to set aside 5 or 10 minutes a day to get out that brush. This isn't just about stray hair throughout your house. This is actually about bonding with your pet. And of course, then we get into pheromones. I mean, you guys know Adaptil for dogs, Feel Away for cats. Of course, there's other name brands out there now, anxiolytic medications, behaviorist consultations, compression vest. Many of you are probably like me. We saw them when they were all the rage. The science is sound behind, compression as far as, mitigating certain anxieties in animals. Having said that, for me, it's your results may vary. So certainly it's something I discuss, but it's not going to be at the top of my list. I do want to talk about the calmer canine though, with some of the new electrical stimulations that are out there. So next slide, which we'll get into in just a second before we get to questions. All right. People know me as being like for natural, have a plant-based dog food, for crying out loud. So they're always asking about natural remedies. And earlier in my career, I was much more optimistic and bullish advocate of like chamomile, valerian, melatonin, even lavender, things like that. Over time, again, the evidence just hasn't been positive. We don't have a lot of studies that really show significant effects. So you don't hear me, being super outward with those recommendations. If a client asks me about them, we will certainly get a dosage. We will try those things, but I'm very quick to point out, hey, I just don't. I can't guarantee that this is going to have any impact or effect on your pet's behavior. Zilkine, of course, casein is a milk protein that's been studied exhaustively for the past 20 years. We got super rich data on this, but now taking derivatives from milk protein that actually have some of that calming effect. I mean, you probably are familiar with oxytocin, right? That's contained when mothers are lactating, and helps bond. But we also know now there are many other proteins and peptides within animal milk that help have a calming effect. So this is one that's out there. A lot of really interesting science behind it. Everybody wants to ask me about CBD oil. I have to tell you, number one, from a legal and a regulatory standpoint, I really can't say much about it. I reside and am licensed and practice in a state that doesn't even allow medical marijuana usage. So if I give specific advice, I can tell you that when I evaluate the literature, it is promising, but it is still inconclusive. I think that for me, the biggest issue that I've had with CBD products on the market is inconsistency. There was just a study out this week that actually showed in several canine or animal formulations, there were presence of heavy metals. So I would say before you administer or recommend, you need to know the manufacturer and quality assurance. So I'm really kind of waiting for this next level of regulatory waves to be passed. And then I'm hopeful that some of these bad actors are going to leave the market. They just won't be able to keep up with the regulations for quality assurance and guarantees, and then we'll have better products. So I'm, again, very hopeful, but in the current day and age, it's just a reliability. I don't have the confidence. L-theanine, absolutely love L-theanine. You're familiar with that with Angstane. Okay, I know I'm not supposed to mention product names, but it's one I like. There's so many formulations with L-tryptophan in there. The dosages vary widely. So just because a product contains L-tryptophan and it says for calming effect, you need to talk with the veterinarian about, is the dosage appropriate? Bach flower, everybody knows Rescue Remedy. Again, in earlier days, I was much more of an advocate for it. And these days, I see as many hits as misses. So I'm not as optimistic, and I don't push that as much as I used to. So again, I think we have better things such as L-theanine, such as casein derivatives for sure. Okay, so next slide. All right. So I do want to talk a little bit about this calmer canine. It is so cool. You guys, if you've dealt with people, human depression, human anxiety, you've started to see these devices that they strap around their head, and it gives little pulses of waves, electrical waves into the brain, the neural tissue. And there are several mechanisms that are proposed for this, but one of the things in humans that's been well documented in evidence is, because we can measure this easily, is the induction of alpha wave status. And so that is a more calming, relaxed, and focused brain state when you have alpha waves. So we know from human literature that these electro stimulation of the brain, the neural tissue, can have impact at least on the electrical conductivity, or these EEG waves that we can measure easily. Now, of course, that same research has been done on dogs. And so that's one of the ways that Calmer Canine works. As you can see, it's a simple halo that has a special frequency of electricity or electrical waves that are then, around, creates a field around the dog's cranium. And typically, you strap this on. There's a lot of details to it, which I do love. Go to ccanimalhealth.com because they've got amazing videos and just information. But what I've seen, and the way we're using it, is we typically will use this for a 4-week trial, and we will see if there's any improvement. Now, obviously, we're doing this in combination with other things, behavior modification, as I mentioned, in the home, and typically working with an animal trainer, behaviorist as well. But we do see, improvements with this. And, I would say that these are the kind of things I'm looking for that don't require prescription drugs. I'm looking for anything that's non-invasive, that has no risk. And so I'm a huge fan of this. I would encourage you, since you're in the animal world with me, to really stay up on the advances. And this is one of those things that honestly, a lot of veterinarians are just now, becoming aware of. And when they do become aware of it and they start to look at the science, like, wow, that's pretty cool. And I think what's going to happen, quite frankly, is with the popularization of these devices for human to treat insomnia, depression, anxiety. These things are becoming more commonly used in psychology and psychiatry. And so I think as people experience it, you're going to see, oh, okay, I get it now. That works for my dog. And really, if they could figure out a way just to strap it around the dog's cranium, I'm sure that would work much better. As we all know, that just doesn't work practically. So they've got a really cool little harness, and the dogs look like little angels. You can, of course, also just hold it there, which is how we've used it for decades. That's where I first got used to the Assisi loop, which is what that device is actually called up there. And we would use this for wound healing, particularly post-orthopedic. It had profound effects. Okay, so next slide. All right. So again, this is just talking about how the electrochemistry, the biology of it. So we can move on to the next one because, again, when you look at neurotransmitters, especially the endorphins, dopamine, serotonin, that's where this stuff is really having its impact. And again, that's derived from some of the human studies, and Assisi is the one who's leading the studies for animals. All right. So I don't know how to make these play, but if you want to show, everybody can relate here. The dog at least it's on the far right of the screen. You can see that's a cage climber, and anybody that's worked in a shelter or foster rescue knows about cage climbers. And so this dog is literally panicked. This is unhealthy. And then this was 4 weeks later. Actually, this video was at the completion of treatment. So this is actually now 3 months later, I think. And they'll have to correct me. I read the case study earlier. But so this is like 2.5, 3 months later. And of course, you can see Reba is just a different dog. Just a completely different dog. They did a lot of work. Obviously they didn't just use the Calmer Canine, but that was part of it. And, I think that when I'm looking for things that work, I'm saying, okay, what are the elements that I can pack together to create the best